Good evening, everyone. So today I am just going to start the new topic, which is very, very new, and just I have presented the few of these slides in the just presented in last week in the ISHACon, that is the Indian Speech Language Hearing Association annual conferences held in Ahmedabad, and I have been invited for this particular talk as I am the blended professionals of psychology and audiology. So I start cognitive behavior therapy. I am providing cognitive behavior therapy in my institute in AYJNISHD National Institute of Speech and Disability Regional Center, Kolkata, since last 3-4 years after COVID and during COVID also, and getting good results in the psychological practice. So I start with a particular note in that way that definitely my ISHACon I have presented this, and my alma mater is basically my Bombay Institute and also my Kolkata Regional Center, Bombay Ali Jabarjong. I have done my post graduations in audiology and speech language pathology and my PhD also in tinnitus, and it is my working place in the Regional Center Kolkata, as well as I have done my undergraduates BSLP, BSR actually in that my time during 96-2000 batch. So I want to acknowledge few people, like first is Dr. Hasir Az and Dr. Brian C.J. Moore, and this particular book has changed my everything, my philosophy of my own self, philosophy of my style of teaching, philosophy of my tinnitus patients care, and the cognitive behavior therapy, what I knew before we have done my master's and PhD in psychology also. But this book is quite different, and because tinnitus is my field of research, so both these iconic human has given me a lot of impetus to understand what is tinnitus and how we can help the people with reference to cognitive behavior therapy. The another important part is that I have found one particular journal that is published in Asha, and that is basically is given by Hasiraz and Brian Cesar Moore, and they have found that audiologists deliver cognitive behavioral therapy is a separate entity for tinnitus, hyperacusis, or misophonia, and a lot of new things are there. You have to do that, and it has been published. You see, the 2018 it has been published, so at least 8 years back. And these are my Kolkata's inspirations. My brother, who is a professor in psychiatry in Sagar Datta Medical College, Dr. Somsubro Chatterjee, Professor Dr. Pritha Mukhopadhyay, Dean and HOD of Psychology Department, Rajabaja Science College, Kolkata University. He is my teacher, she is my teacher, and she is my mentor. My another mentor, Dr. Sudeep Basu, is a clinical psychologist in Ali Jabarjong, Kolkata. And of course, my colleague and my director, Dr. Suman Kumar, sir, because he has given me all sort of inspirations to do all sort of innovative new work in this field of tinnitus. And I definitely, you all know, because I have already presented, tinnitus is basically a noise, buzzing noise when there is no external sounds and your brain is occupied because of the central gain theory, your cortex and your limbic system mismatch. So there will be a lot of spike and lot of stimulations, and that stimulations are the aberrant stimulations. Mostly the sensorineural tinnitus or a normal type of tinnitus in the normal hearing patients are more often we get, that is the subjective tinnitus, but definitely there are some objective tinnitus like pulsatile tinnitus, the vascular tinnitus, and differently with reference to palatal myoclonus or some muscle spasm, already it is there in reported. But there is no very much clear-cut cause of tinnitus still date, but a lot of tinnitus patients are reporting that they have buzzing sounds like of insects. Sometimes the sounds are like a running engine, like a grinding against metal, or some fan noise, or some hissing noise of tea kettle, or fluorescent light noise. And these are the area where you know that singular gelates, frontal cortex, posterior cortical cortex, these are the corticolimbic system. And if we target one area, definitely it will help, because the distress, when we are talking about the tinnitus distress may be is reference to the mesolimbic dopaminergic pathway systems are imbalanced, and it improvises the serotonin and the cortisol level. So these imbalance are there. People are frustrating. People are getting a lot of emotional swing, mood distress, mood swing, mood distress, and sometimes they're suicidal also. So it's a very strong case. And a lot of tinnitus treatments we are getting. So cognitive behavior therapy can be done with reference to with the help of CTRT, with the help of sound therapy. Even we can combine with reference to electrical stimulation and magnetic stimulations. All those things are coming up in the next 2-3 years. Our research are going on. So just above has been already provided the model that mixing point means it is an habituations. So it is not the suppression directly with the sound masking. And the habituations means it is controlling the cortical path as well as the emotional path with reference to the eliminations of the triggers, which is in that level of cochlea, and also annoyance with reference to the autonomic nervous system. These are the different studies shows that the blue line is the tinnitus line. Tinnitus has a lack of amplitudes of normal controls. Sometimes it is a higher peak one in the acoustic change complex, but still there are a lot of researches are going on and that shows the amplitudes are sometimes very high and from the normal, and latencies are delayed. And we have also done some studies where we have found the same line at the research, what research are there. And definitely the cognitions means perceptions, reasoning, evaluations, judging, learning, remembering, as I've already explained. And you see what is the situations. Situations means what is the trigger of the problem. So like, for example, I am being criticized in my work. So I am not doing work. Still I am working. But people are saying that I'm not working. So that is a situation. So it triggers some bad thoughts. So I'm not good enough, maybe. So it is my self-actualizations that I'm not good enough. I've been always failed. Leads to the emotional thing. So I am worthless. I am very much anxious. What will be the next? And my behavioral reaction is I'm avoiding actually to contact with others. And then the physical reactions maybe I always feel exhausted, loss of appetite, maybe irritable bowel syndrome, a lot of pain, phantom limb pain, etc. So thoughts create feelings, feelings create behavior, and behavior reinforces thoughts. So this is the pioneerizing work given by the Beck et al. And Beck study, Judith Beck. So she is mostly she has done all the framework of the cognitive behavior therapy. And CBT is actually an evidence-based psychotherapy based on the idea that thoughts, emotions, behaviors are interconnected. So it is a CBT triangle. Like, what is CBT triangle? Thoughts influence emotions, emotions or mood influences behaviors, and behaviors reinforces weaken certain thoughts. So it is an automatic bad thoughts are coming. So that is called cognitive distortion or thinking errors. Means these are inaccurate or exaggerated ways of thinking, such as catastrophizing. For example, if this happens, everything will go wrong. That is catastrophizing. Means it should not happen. Overgeneralization, I failed once, I will always fail. How do I generate, overgeneralize that I will always fail? Mind reading, they must think I am a stupid. What a ridiculous thought it is. Black and white thinking, either I am perfect or a total failure. So it is like an all or non-law principles of the neurons. So CBT is a skill-based therapy techniques. It involves learning new thinking patterns, practicing healthier behaviors worksheets, homework, and real-life tasks, measuring progress. So I follow mainly Hasi Raz and Dr. Brian C.J. Moore, and sometimes I use mindfulness-based stress reduction also. I'm coming later. So there are 7 steps of cognitive restructuring. One is you have to identify the trigger. You have to record in one particular diary. Identify cognitive distortion. What are the wrong automatic thoughts? Examine the evidence. Really, you are having these thoughts, and why these thoughts are coming. Is it true? It is false. Reframe the thought. So you are balanced persons, and you have a plan, a response or actions. Accordingly, you have to act. Don't act based on the distorted thought. And you have to reflect on the process. So there are mainly 4 areas. If the situation is bad, it provides the automatic wrong thoughts. It provides the bad feelings, and then you accordingly behave wrongly. So that's why this type of worksheets you have to write. Whatever you are having a different bad thoughts, you have to write. and you have to always change to alternate thoughts. So in that way, you can change your thought model. So there are some ABC model of cognitive behavior therapy. A means activating event. So an event prompts the start of the reactions. B is the beliefs about the event. This determines the emotions about the event and behavior afterwards. So how your events are activated based on your belief systems comes. Maybe the false beliefs are coming more often compared to the good belief, because false belief associated with glutamate. The good beliefs are associated with the better hormone like GABA. So the consequences, this is how you feel, and now you know that what to do with response to that particular beliefs. For example, there are a lot of events like the world, other people, personal experiences, personal history, future self, all are events. And what are the thoughts? Your attitudes, rules, demands, your beliefs, maybe it a false belief, maybe true belief, images, the meaning of life, means some emotional health or behavioral health. Emotional health means or healthy feelings or unhealthy feelings. That is, you will get the physical sensations. Sometimes you are saying you are getting pain sensations or some life skill balance imbalancing. Behavior means constructive actions or destructive actions. Both can be present in the same time. So there are some vicious cycle of depression. So if you feel low, then you stop doing things that matter, then you get less out of life, then again you feel low. But the positive cycle is, if you feel better, it gives you get more out of life, you do more of what matters. So behavioral activations means you are giving the behavioral activations from the depressive thoughts, that is feeling low, to the positive reactions, that is feel better. So how CBT works? There is a step-by-step procedures. Like you have to understand first the problem, the current problem, when it occurs, at the time you have to note what are the different triggers, like caffeine. Sometimes you drink 3 and it triggers. What thoughts, emotions appear to that? So for example, a student says, if I speak in class, everyone will laugh. There are a lot of other things, like one situation, automatic thought, like they will laugh at me, and then your emotions goes up to 80%, and your behavior, you are not talking to anyone, so you are stayed silent. So what is the cognitive restructuring in that particular thing? So your negative thought, everyone will laugh. So what are the evidence for? Felt embarrassed once before. So evidence against others speak without being laughed at. Not everyone observes closely also. So balanced thought, some may look at me, but it's unlikely they will laugh. I can try. So it is the positive thought. So somehow you manage. So what are the behavioral techniques? So behavioral activation for depression, increasing engagement in meaningful or pleasurable activity, like 10-minute morning walk, completing one small task per day, and talking to a close friend regularly. You can have exposure therapy, like gradually facing feared situations. So if you exposed more, so it is called one type of autogenic relaxations, or it is called flooding. One technique is called flooding. So if you are exposed means you know the situation, so your phobic level will be reduced. So it is one type of habituations again. So what is the example? Like one social anxiety exposure hierarchy, like talk to a family member, you can ask a small questions to a shopkeeper, participate in a small group discussion, speak briefly in a class meeting. So you are now engaging. What are the skills training? Problem solving, communication skills, relaxations. You can use deep breathing exercises, progressive muscle relaxations given by Jacobson. You can use mindfulness, or there are a lot of anger management therapy, ACT, that therapies are also there. So what are the homework and review? So CBT heavily depends on homework practice, such as thought journaling. So you have to write the thoughts whenever it is coming. Behavioral experiments. So a lot of behavioral modifications you can do on your own. So that's called auto suggestions. Exposures, always exposures leads to habituations, and also you have to monitor the mood. So always you have to go for the positive vicious cycle. So what are the different type of cognitive distortion as it is there in the different literature? Overgeneralizations, mental filters, discounting the positive, jumping to conclusions. It's very different. Mind reading, you are always your negative thoughts. Predictive thinking, it may happen, I may be failure in that way. Magnifications, very big thoughts that I am nowhere, so I should go for some suicide or something. Emotional reasoning, should and must statements. we should, but if you have some that I should uh, fail in this particular class and something, you label yourself as a failure, personalization and blame yourself and your environment. Sometimes you are so much catastrophizing that you cannot believe yourself also, and definitely black and white thinking I've already explained. So then all or none thinking is one phenomena. So I failed this test, so I am a failure. So what is the balance thought? Once failure doesn't define me. So one time failure, everybody can fail. It is not that I am not failed and all time I have done my success. It is not possible. So what is the catastrophizing? If I make a mistake, everything will collapse. So balance is mistakes are manageable. That's why we are there in the society. Mind reading, they must think badly of me. So what is the balance thought? I cannot know what others think without evidence. So if I am bad, so I should have evidence. So why should I know that the evidence is there? So should statement, I should never make mistakes. It is not possible because everyone makes mistakes. To err is human. So human cannot do mistakes means they are God. They cannot be human. So it is not possible. Emotional reasoning, I feel anxious, so something bad must happen. So what is the balance thought? Feelings aren't facts. So facts is, you have to find the facts. Cognitive restructuring means you have to balance your evaluations of evidence, and repressing thoughts means I may feel nervous, but I am capable. And there are some graded exposure, like you in front of mirror, you are practicing, you are talking, speaking to two colleagues, presenting for 2 minutes in a meeting, full meeting presentations. You can use deep breathing or box breathing techniques, like take deep breath, hold for some times, relax with the mouth and hold for some times, and again take and breathe. So it is like in box. Take a breath, hold, release, hold, breathe, hold, release, hold. In that way, there is the box breathing you can do. Deep breathing means more deep, more deep. So it stimulates the vagus. So 4-7-8 method. First the 4 seconds, then 7 seconds, then 8 seconds. Gradually you're increasing. Or you can do the progressive muscle relaxation from the lower end to higher end and block the breath, and then you can release and you relax from the up to down. In that way you can use the part and full body relaxations. Homework, like you have to maintain daily thought log or exposure task. What are the outcome? Anxiety reduced from 60% to 20%. There are a lot of outcome are available. Patients may improve their confidence. I have found a lot of patients are coming and say that what you have told, sir, it is marvelous. My life has been changed. So we are impacting on their life of the tinnitus patients. More accurate thinking patterns are developed. So CBT for chronic tinnitus, it is very, very important. So the main code, the line is escape the trap. So how do you escape the trap? So tinnitus is not important. Turn off the alarm. So you should not be alert. Jane do means it is the flow theory. So you should not always you're stimulating your reticular activating system. So your alarm band should be reduced. So if you reduce your emotional reactivity, tinnitus awareness, so you reduce your distress, you improve your good functioning, habituations, and then it reduces the tinnitus things, and your psychological response are very good. So the next is the CBT for tinnitus focuses on reducing emotional distress, changing catastrophic thoughts, and improving habituation. It does not aim to remove the tinnitus sound, but to reduce the impact of tinnitus on mood, sleep, focus, and daily functioning. This protocol integrates maybe CBT with audiological components. Not that we are only doing CBT, we forget audiology. It is not that I'm an audiologist basically from my core of my heart. So I have to do sound therapy. I have to do also cognitive behavior therapy, some sleep management. Sometimes if there is an hyperacusis or misophonia, we should go for that differential diagnosis, and we should manage it in the different level. So there are some protocol, sessions wise protocol, like assessment of audiological components, assessment of CBT. You have to use homework, then you use the cognitive model, identifying automatic thoughts. So you have to use a diary. Then session 3 is the cognitive restructuring. So step by step, what I have told, that you have to provide some catastrophic thoughts, balanced thought, catastrophic thought. In that way, you have to go. You have to provide them homework for 2, 3, 4 sessions, at least for 2-3 weeks. Attention control training is very, very important for actually tinnitus becomes loud because the brain fixates on it. So goal is train the brain to shift attention away. So it is your attention shifting techniques. There are a lot of attention shifting techniques are there. So one is focus shifting. So 30 seconds on tinnitus, 30 seconds on the external sound, or you can provide Zen music and repeat. Then selective attention, listen to a fan noise, music, environmental sound while ignoring tinnitus. Dual task exercises like simple cognitive tasks, some different tasks, and including background noise. So practice at home mostly 3 times daily for 5 minutes each. It is the very, very important method. Behavioral interventions like why, like client often avoid silence, social situations, work or sleep due to tinnitus fear. You may have an exposure plan and provide extra examples. So 1 to 2 times daily, you have to give the graded exposure. You can combo with the sound therapy integration. So you can use partial masking. You can use different natural sound masking, hearing aids also for hearing impaired. So you can use different type of hearing aids. Even so many hearing aids are nowadays AI generated hearing aids are there where you can have a mode simultaneously. The amplifications and the tinnitus controls are there. Like fractal tone is also used in some hearing aid company. They are using some different Jane tone or fractal tone. And you can use some relaxations management like deep breathing, progressive muscle relaxations, mindfulness. I am using mindfulness often in a different time. And also we are working on anxiety, depressions, irritability, anger, and social withdrawal, but at the level where I can manage the tinnitus, hyperacusis, or misophonia, not that it is beyond my control. If it is that, then I have to take care of that with reference to referring the patients to psychiatry department and clinical psychologists for that. And we have a team also. And there are a lot of different CBT techniques are there. So for hyperacusis also, desensitization trainings are very important. And we can create a long-term plan. So not that it is now you have done it and then you are not following it up. So it is very bad. So this is the AYJNISHD, the RC Kolkata protocol. So step 1, we use the learn about tinnitus, the first thing, at least 1 or 2 sessions. Step 2, self-assessment with different questionnaire like tinnitus impact questionnaire, sound sensitivity symptom questionnaire, hyperacusis impact questionnaire, screening for anxiety and depression in tinnitus. All are there in given by the Moore and the Hasiraz. And then step 3 in the part 2, learn about CBT. So we teach CBT directly. We test the water means how actually it's like. So then the readiness we have to measure. Then we customize treatment based on the actual problem. Then we start the exposure. Then it like a sunshine. You then provide it for the home. And actually your lifestyles is now with reference to reducing the automatic bad thoughts. That is called CB style. So these are the area. And I always use mindfulness with reference to meditation, breathing, balance, stress reduction, awareness, and body soul integration. So there are a lot of techniques like how you can use your emotions to cognition, to cognitions, these supports, how you can, it actually boosts immunity, it supports working memory, you can have a good sleep, etc. So there are different type of mindfulness therapy in the literature like mindfulness-based cognitive therapy, mindfulness-based stress reduction therapy, and mindfulness-based cognitive behavioral therapy. I follow the Gautam Buddha's protocol because Buddha's 8-fold paths are always the path finder. Actually, we can get the path is with reference to Gautam Buddha. So it is a Buddha's principle of Vipassana. 2,500 years back, maybe he has given a lot of things, but now neuroscientists are proving that it is right, it is correct. And then it is like right understanding to right thought, to right speech, to right action, to right livelihood, to right effort, right mindfulness, and right concentration. So that is actually the hierarchy of the conscious process, the body soul integrations, and that is the mindfulness. So what are the benefit of mindfulness? Definitely your heightens of your awareness. You can enjoy every moment. You are having a peaceful life. Your harmony with your being, your self-aware, your self-development will be improved. Your concentration and you will be focused. You increase concentrations. You regulates and creates balance in emotions. Relaxes the mind and body, reduces stress and lower blood pressure. So your cortical balancing is the main benefit. So physical betterment, cognitive enhancement, mental health benefit, and emotional well-beingness are the better things. So these are the mindfulness benefit. This is there in the Frontiers in Neuroscience published in 2025. And these are the different scale, mindfulness, attention awareness scales. We are using oftenly those scales. And sometimes we use the 5-facet mindfulness questionnaires. There are different facets are there. And these facets like this questionnaire, like observing, describing, acting with awareness, then non-judging, then non-reactivity, and then total score. So the pre and post scores we are having. So there are few quotes are there. So one Nahat Han, the spiritual person, she has given the things that the present moment is filled with joy and happiness. If you are attentive, you will see it. So non-judgmental happiness. And John Kabat-Zinn, actually I am following his book, which is the mindfulness-based scientific book for therapy. So mindfulness is a way of befriending ourselves and our experience. So we are even alone, we can enjoy my life. And Chatterjee and my student and my colleague now Ambika, we have studied with reference to MM and P300 are getting a lot of different improvement in terms of the latency and the amplitudes with using the particular oddball paradigm, and got a very good results after giving mindfulness based stress reductions. So we have a lot of techniques like mindfulness meditations, mindfulness breathing, mindful movement, mindfulness in everyday life, body scanning, loving kindness, visualizations, and 3-minute breathing space. So actually awareness provides the acceptance through mindfulness. So mindfulness is a tool. So emotional intelligence provides you the mindfulness, and if these two are balanced, it is actually influences the full science of neurology or neuroscience. So mindfulness-based stress reductions means deep breathing, mindful body scan, informal and formal mindfulness meditations, seated and walking meditation, stretching and mindful movement practices, including yoga, group dialogue, gratitude journaling. So this is an 8-week protocol given by Kabat-Zinn. So week 1 is basically meditations, week 2 mindfulness breathing, week 3 body scanning or yoga. So body scanning is the week 1. So week 1, week 2 is the breathing, week 3 is the yoga or stretching exercises, week 4 is the group stimulations, so body mind algorithm. Good 5 is basically week 5 you are doing the thoughts provoking, or you are not associating the thought anymore, so your thought stopping. Then you are communicating with different your extra things, like you are not feeling these things and you are writing that you are improving. From week 7 it is basically the rehearsals. Week 8 you are getting all those reliefs. So 8 week you are getting these meditations through breathing, balance, stress reduction, awareness, body soul integration, and you can reach the goals. So there are a lot of studies are there with reference to mindfulness meditations. So mindfulness based cognitive therapy and mindfulness based stress reductions both can be done. So I am basically in the green zone. I am using these techniques in my institute and I'm getting good results. I follow this particular book. That is a very beautifully written book, mindfulness based stress reductions, and based on that I am developing my brainchild of I am taking a patent on positrix, and this is based on this particular book. It changed my full life actually and life skills. So it is a study by myself and Ambika, and we got that this basically the mindfulness improvises definitely the tinnitus patient's thoughts. So mindfulness-based stress reductions means it is an 8-week course MBTSR, but we are shortening it to the 4 weeks course in Positrix. So evidence-based practice, definitely there are a lot of studies with reference to Buchholz and Anderson's, and Binoy Manchaya. We got the CBT techniques. We get a lot of misophonia treatment like Hasiraj, Taylor, Dennis, and Brian C.J. Moore. We have also Hasiraj one techniques, audiologist delivered cognitive model, and cognitive field therapy based on Buchholz, Anderson, etc. And we have one study with reference to P300 response in tinnitus, with reference, and we get the P300 is improving with reference to latency and intensity. And it is my study published in the Indian Journal of Otolaryngology and Head and Neck Surgery very recently. And also there are few more paper on Hasiraj, and in Audiology today they are saying that there are some procedures they are developing, they are developing the techniques. We have some apps, like first is the MindEar app. I am using it sometimes for patients when I am giving some mindfulness practice. So here both the auditory training and the mindfulness both are there. Sometimes I use mindfulness app, or sometimes I use the Resound Relief app, because those are freely available. So you can definitely access through Play Store, iOS Store. And I also follow the new technique of positive psychology. It is called the PARMA model given by Martin Seligman. Means always we should not see the person as a disorders. We should, even in the normal, we can prevent the disorders. So that is the PARMA. So if you have a positive emotions, you can engage yourself in a positivity. That is a flow. You can change your time with a good hope, with a good belief. You make a good relationships with others. You may join with your family, friends, and colleagues. You get the meaning of life, and definitely you get accomplishment to striving for and achieving goal gives a sense of pride and mastery. So the Martin Seligman in 2011, he has given this particular PARMA model, and he has written in this way: just as the good life is something beyond the pleasant life, the meaningful life is beyond the good life. So actually we want the meaningful life. In COVID-19 outbreak, we have studied with mindfulness-based tinnitus stress reduction based on Co-ordinator protocol and got a very good results significantly when we combine these two techniques, DRT along with this particular mindfulness therapy through telerehabilitation modes, and we get a very good results on tinnitus cognitions questionnaire as well as in tinnitus handicap inventory. And definitely we are now doing this particular positrix. It is the one my brainchild. Also my colleague Ombika, she is now joined in the my institute in Hyderabad as an assistant professor, and also we are doing a lot of techniques, lot of skills on positrix, and it is still in press in the international level of journal. So it is in press, maybe another 1 or 2 months it will come. So thank you